The Straits Times Hong Kong correspondent Claire Huang joins us now because both Singapore and Hong Kong have been praised globally in their handling of the crisis. But while the number of confirmed cases in Hong Kong has slowed to single digits, Singapore is seeing triple-digit figures in new cases. Compared to Singapore's total count of 3,252 cases as of Tuesday, Hong Kong has just over 1,000 cases. Claire, what are the main differences in what the Hong Kong and Singapore authorities have done to manage the outbreak?
They have done pretty much the same thing. They were incremental on both sides, particularly on social distancing measures. But Singapore had a slight head start in terms of border control. It turned away visitors earlier, while in Hong Kong, the healthcare staff went on strike to force full border closure, which didn't happen. But by February, 10 out of 13 borders and crossings were shut. That said, Hong Kong was very decisive in shutting schools, and that was already done, after the Chinese New Year holidays. So it was extended until now. And today, the government said that the university entrance exams would go ahead next week as planned if there is no escalation in the situation.
While the actual interventions in place are indeed important, it's also about how serious people are taking these measures. Now, Claire, you wrote a story about how the scars of SARS have contributed to the Hong Kong public voluntarily changing their behavior. Tell us more.
So like Taiwan, right, Hong Kong people remember SARS very well. They had 300 people who died in the pandemic. And so, when this started, when news of this virus, broke out, remember the face mask rush that was in January, February. That was very early. The people here are very quick to react. Because of the memories of SARS. And also, a lot of the Singaporeans I know here say they wear a mask because it's now social etiquette in Hong Kong. And it's also done to, for a peace of mind, right? Because nobody knows whether they are a super spreader, things like that. So they do it. So people do it here quite voluntarily and very willingly. And they know that they do it because, you want an added layer of protection.
Yeah. Now, Claire, on the topic of masks, wearing masks when you're out was just made mandatory in Singapore. Conversely, because of the ban on face masks triggered by the months-long pro-democracy protests, people in Hong Kong had to fight to be allowed to wear masks. How did that play out? Did it take long for the government to rescind the ban in light of the COVID-19 outbreak?
So the face mask ban came about last October because of the unrest. Last week, the Hong Kong Court of Appeal ruled that a ban on face masks at authorized public assemblies was unconstitutional. Okay, but it also found that such a ban at unauthorized protests does not contravene the basic law. So the Pan Democrats are now disappointed, and they say that they will bring the matter to the Court of Final Appeal. So watch this space.
Well, Claire, what's the situation currently in Hong Kong? What have been the key factors in keeping the case numbers lower than in Singapore, especially when it comes to new daily cases?
So Hong Kong's tally stands at 1,016, including 4 deaths, and more than 450 people have been discharged. The daily numbers have been at single digits, and I think they hit a low of 3. So I think this is, besides the memories of SARS, which has made them more vigilant, Hong Kong has also very strong grassroots. So a lot of the initiatives, things like handing out masks to the needy, to the cleaners, are ground up. You don't have to wait for the government to do anything. So these people come out, they source for the masks, they source for sanitizers, and you see them giving these things out to people who need them. And you have that here because people don't really trust the government to help them. Trust in government basically is at an all-time low. So, they do it themselves. It's quite the opposite in Singapore, right? Where I was told that people think that because it's Singapore, healthcare services are reliable and good, so you have a safety net. But the problem comes when everybody starts thinking this way. Over in Hong Kong, I think that the lack of trust actually in the government is a key factor, and so people volunteer and they rally together on their own.
Right.
Well, thank you very much for your time, Claire. That was indeed very insightful. Stay safe as well. That was our Hong Kong correspondent, Claire Huang.